Thank you, Chairman. Thank you to the three of you for coming out here and talking to us about this important issue. And when I was preparing for this, I was trying to talk through to some of my constituents back in New Jersey and hear the challenges that they're facing right here and now. And I remember I was talking to Cindy from Tom's River, who I'd recently met with, and she was saying that, she said, quote, "I received a new premium estimate for 2026. I wanted to share them with your team. Last year, we paid approximately $27,000 for our plan for our family. This year, the same plan will cost us approximately $50,000, an increase of about 85%. And I think about this, Cindy's 85% increase is half of the average increase that we're expected to see in New Jersey of about 174%. I've heard a lot of these stories, unfortunately, across my state and across this country, and I'm worried about what we're going to be able to do for Cindy and others. And Dr. Fegan, as a physician and a former chief medical officer, I know that you have seen firsthand how devastating it is not to have health insurance or access to care. So I wanted to ask you, what kind of choices have you seen your patients make when it comes to health care becoming unaffordable? Would you be able to provide some insights on how many Americans are likely to forego necessary or regular healthcare visits and what the overall consequences would be on our nation's public health?
Well, it'd be devastating on our public health. I mean, we already have, a shortened 4 years shorter than most other industrialized countries in terms of life expectancy. But what we see is that patients forego preventive services, that patients don't get their blood pressure checked, that patients don't get pap smears, that they don't get mammograms, things that don't hurt, that, they don't feel any immediate effect. And the results are that we're treating more advanced stage cancers, that we're treating more the cardiovascular disease that results from uncontrolled hypertension, and patients with diabetes. The Rand Corporation did a study back in the 70s where they looked at co-payments as low as 50 cents to $1 and found that co-payments deter people from necessary care just as often as unnecessary care. They repeated that study in the early 2000s where they looked at co-payments for medications, and they saw that patients systematically decreased the medications they took. First, they stopped taking their arthritis medicine, or they took it every other day, or they took it once a week. The next thing they cut back on were their blood pressure medicines, where they would spread it out over, every other day, or stop taking once a week. The last thing they stopped was their diabetes medications. But we know when we put costs in between patients and care that they make decisions, and they aren't wise decisions, and they will, like I said, they've shown deter people from necessary care just as often as unnecessary care. So there's a high price we pay because there's decreased productivity from workers who are not able to function at full force because of illnesses that go untreated.
Dr. Fegan, these families that are seeing these prices double, triple, is it their fault?
Absolutely not.
Ms. Strauss, these families, is it their fault that their prices are going up?
No, it's the ACA in Congress.
And Mr. White, is it their fault?
No, it's the law and the underlying medical inflation.
I think we all agree there's a brokenness to the whole system. And I very much wanted to be on this committee to try to find bipartisanship in terms of a solution for that can try to address this. But I think the challenge that I'm having, Mr. White, Ms. Strauss, Dr. Fegan, there are lots of different plans that are out there that have been talked about. But do you see something, is there something that we've talked about that can be implemented in the next month that can offset the costs that these families are facing? Mr. White, is there something here that you see that can be passed and implemented in a month?
Within 2026, there's 3 things you can do. The first thing I think is...
I'm asking about the remainder of 2025. Before these...
Do it in 25, it will impact 26. So the first thing you should do is fund CSRs. That will reduce premiums by 11%. That was actually in the bill, the one big beautiful bill, in the House version that passed.
That can be implemented by January 1st?
Mid-year, I would say.
Mid-year.
Yeah.
Okay. Anything that can be implemented by the beginning of the year?
You can immediately give those subsidies to consumers through an HSA product.
That can be, you're saying that can be done?
100%, because bronze and catastrophic plans are now HSA eligible in every area of the country. You can take that $625 and give at least half of it to those
HSAs,
consumers.
they're tied to specific types of health plans, but more importantly, they cannot be used to pay for health insurance premiums.
Right.
So can you explain how that's going to lower the premium costs that these...
I would suggest that should be a fundamental part of that law, that you should allow those subsidy payments to go to those individuals as part of bronze and catastrophic, and allow them to use those dollars to pay for premiums.
I'll just end here, Chairman. It's just saying, like, look, I'm open to exploring different ideas that are out there, but Cindy and all these other people that are facing, they're going to have the rug pulled out from under them. Why can't we, even if it's not perfect, extend and be able to give them some support while we get our acts together here? And that is what I just feel like they're seeing us and they feel like we're playing with other people's chips. And they're right. You know, we're not the ones that are going to be feeling this. And I just urge us to try to figure out how we can help them in the meantime. With that, I yield back.
I'll take the chairman's privilege. If they request a bronze plan, they will have a lower premium. In fact, if you look at it, for most people on a bronze plan, it's less than 8.5% of their income, which is kind of the target we've been shooting for. They do get a higher deductible, but if you use that subsidy to put it into a HSA, their net deductible can be lower. And as Mr. White said, we've already made those bronze and copper plans eligible for HSA, so that law is in place. The only difference is that you want that subsidy to flow into the HSA to the patient instead of to the insurance company. So yes, you can lower premiums simultaneously with funding those HSAs under current law. Thank you.